The American Cancer Society estimates there will be about 15,000 new cases of throat cancer this year. And in this week's CHI St. Vincent Your Health report, doctors explain why easily overlooked symptoms can make this such a hard cancer to catch. Mackenzie Ricard was diagnosed with mono and walking pneumonia when she was just 18, but when her breathing got worse, a doctor found a large mass in her neck.
It came back as cancerous, and after they removed 90% of it, it was still the size of a large grapefruit.
Ricard speaks in a whisper after undergoing surgery, chemo, and radiation therapy.
Her voice is horrible because where the cancer was, it had destroyed her vocal cord on the right side. And although the cancer is no longer there, the normal tissue is no longer there either. And so therefore, she doesn't have a real good voice.
Dr. Jeffrey Miller is an ear, nose, and throat physician with CHI St. Vincent. He says smoking, heavy drinking, smokeless tobacco, and certain viruses like HPV can play a role in throat cancers.
Head and neck cancer traditionally has been an older male cancer in heavy drinkers, heavy smokers.
He says the biggest problem with throat cancer is you typically can't see where it is, so it may be hard to know when to get checked out.
The general guidelines are if you've had an appropriate illness, caught a laryngitis, it's cold and flu season or pollen season and your throat's a little raspy, or you were at the football game and you were yelling and you had a laryngitis and it cleared in 5 to 7 days, obviously that's not an issue. But typically anything that continues on for about 2 weeks or longer, you ought to at least see your regular doctor, get evaluated, and if the treatment they give you doesn't get things cleared up, you need to be seen by an ear, nose, and throat specialist.
Dr. Miller says at some point they may be able to do a reconstructive surgery to help her voice.